Hello and welcome to my YouTube channel. My name is Morgan and I'm a clinical mental health counseling student at Capella University. Today I'm going to be talking about the very first class that I took at Capella University, which it's probably everyone's first class if you're in the clinical mental health counseling program because it's called Introduction to Clinical Mental Health Counseling. So the first thing you need to know is that Capella University's clinical mental health counseling program basically has the same structure for every class. There are about 3 papers that are anywhere from 5 to 10 pages long. Usually the first paper is week 3 or 4, and it's about 5 to 7 pages long. The second paper is week 5 or 6, and it's usually about 8 pages long. The third is almost always due week 9, and is almost always about 10 pages long. This can vary a lot, and there's often 4 big assignments, but that's basically the structure every quarter for papers. For weekly discussions, you will make a post that's visible to the entire class. It should be 3 to 5 paragraphs long, and then everybody comments on each other's by the end of the week. Most courses at Capella University, it's done through Canvas, but in this course and some other courses, it's done through Yellowdig. In Yellowdig discussions, I've noticed that the topic is a lot more flexible than it is in Canva posts. In the intro class, honestly, you wouldn't even need to complete the readings to do really well in the discussion. Just put in a lot of effort. I'm not advising you to just skim headings. What I'm saying is if you want to spend this time in this prompt to really inspire you to dig deep into the Capella library, really research something that you're interested in and that you want to specialize in. What I did typically was figure out the main topic in the readings and then find a clinical study that explored that topic more in depth. For example, if the reading was about reflective listening in human counseling techniques, I would find a study that talks about reflective listening techniques in a CBT approach or an integrated approach for victims of trauma, and maybe it compares a few different modalities there. Whatever you do, make sure to cite it in APA correctly. You always have to do this for a graduate class, and a lot of times people forget in Yellowdig because it's a lot more casual. I would recommend reading about your next paper before you go into the weekly readings because then you know what to expect and you can jot down notes as you go. If you start a separate Google Doc just for this future paper, it will save you so much time later. The discussion topic is always related to the weekly readings, and I would recommend that you read it before you read any of the weekly readings just so you can mentally filter out what's important and what's not as you go throughout the week. By the end of this course, you'll need to know how clinical mental health counseling is different than other counseling specializations. However, don't over-focus on psychopathology. You will need to know a lot about the wellness model and the wheel of wellness. And when in doubt, connect the topic to wellness. Don't feel like you have to know everything yet. If you ever get really stuck, you can always find an article that teaches the same concept in a slightly different way, and maybe the study has a slightly different population or diagnosis or modality. Then you can bring that summary to your discussion and make sure to cite it in APA. I'll put some inspiring resources below. If you are struggling with imposter syndrome, I'd encourage you to watch my other videos. Thanks for watching.